Are you a radiographer? Are you a nurse? Are you a healthcare assistant? You're a care worker? Are you a sonographer? And you absolutely want to smash your supporting information? Well, you're in luck. You're in luck because in today's video, I'll bring to you detailed tips on how to smash your supporting information and win big with it. Okay. Now, what's even better is that as much as I'm giving you tips, to get your supporting information up and running, I'm also giving you examples on how to use them. So you've got tips on one hand, you've got examples on the other hand. So you got the full package. So if this appeals to you in any way, stick with me because I'm here for you.
If you're new to my channel, my name is Rajuno. I'm a Nigerian sonographer in the UK, and in today's video I'll be showing you how to structure your supporting information, how to extract keywords from the job description and person specification. Now, using keywords in your supporting info is important because some organizations may use applicant tracking systems, ATS, to help with the recruitment process. Now, these systems can scan resumes and supporting documents for relevant keywords to identify qualified candidates. So using these keywords helps to increase your visibility and the likelihood of your application getting noticed. Now, even if ATS systems are not being used, being able to use industry-specific keywords showcases your familiarity with the field and its terminology, and this can be very appealing for employers. It also shows you have a solid understanding of the industry and you are well prepared for the specific challenges and expectations of the role. Now, in today's video, I'll also be showing you how to incorporate stories and examples in your supporting information to make your supporting information more personalized, more authentic, and relatable. Now, your authenticity helps to increase your chances of getting picked for interviews, so this is a valuable skill to have. And finally, I'll also be showing you how to use your supporting information to effectively demonstrate the way your skills, expertise, and qualifications fulfill the specific requirements for the role.
I did a video on the things you must not do on your NHS supporting information. If you haven't seen this video, then make sure to check it out on my channel because today's video will serve to complement that video. It is super, super insightful and I'm sure you'll learn a lot from it. So check it out. I'll drop a link below. Okay, so let's begin with the steps on how to write a very strong supporting information.
Now, this is an NHS job vacancy for a Band 6 radiographer in London. Now, the first thing you want to do is to go through the job summary and the general description, then proceed all the way down to the specific job description and the person specification. Now, you want to read through this, open them up, read through them, after which you want to check if they offer sponsorship to overseas workers, especially if you're applying from outside the UK. As you can see, this particular job offers sponsorship to overseas radiographers, so that's good. Now you can go ahead and download the supporting document and also go through it. So this is me downloading it and this is the document. Now you should read through the job description. Take your time to read through the job description and then scroll all the way down, keep going down and reading, and then all the way down you'll find the person specification. Now usually you'll find a summary of the person specification in a tabular format towards the end of the document. Now take note of this table. Can you see how they have tabulated their requirements into education and qualifications, knowledge and experience, skills and attributes, and the trust values at the end? Now that's good. You will use this table that they have basically made for you as the table of contents for your supporting information. Now, this will essentially help you to stay organized and to concisely structure your supporting information so you don't end up having information flying all over the place. You want your supporting information to flow harmoniously when the recruiter is reading it, and this will help you to achieve that. Now, on to the matter of keywords. This person specification is flooded with keywords which you must include in your supporting information. Now, how do you identify keywords? Usually, minimum educational requirements, professional registrations, and certain skill certificates are keywords to look out for. So in this case, HCPC and BSc radiography are important keywords to include in your supporting information. Also, having a cannulation certificate is also a keyword to take note of. Now, this requirement to have this cannulation certificate is not in this tabulated person specification, but it was mentioned in the job summary at the beginning, which is why it is important to always read through everything so you don't miss key requirements like this. Another way to identify keywords is to look for required experiences. This would usually reveal core keywords to include in your supporting information. Now, in this example, you can see the requirement to have experience in A&E, CT or MRI experience, manual handling experience, engaging in CPD, theatre and out of hours work experience, etc. They are all keywords which you should include in your supporting information to help you to stand out. Now, another way to look for keywords is to look for action verbs. In this example, you have action verbs like teach or lead or motivate, etc. These are all keywords. Another way to look for keywords will be to look out for soft skills such as having initiative, communication, empathy, etc. These are all keywords to include in your supporting information. Now, these are some of the keywords in this vacancy. Now, there are many, and I haven't included all of them, but these are some important ones which I will be incorporating in the examples later in the video. You don't have to meet all the desirable attributes. If you meet the essential attributes and your application is strong enough, you still have a good chance of being considered for the job.
So now that you have identified your keywords, which sometimes is pretty much the entire person specification, you want to now start writing your supporting information. So let's do it.
As always, you start anything with an introduction. Your introduction should essentially summarize your professional intention. It should summarize the most important bits of your career as a radiographer, and it should quickly highlight your suitability for the role. Meanwhile, remember you already have a ready-made table of content to follow, so seamlessly infuse the first section of your table of content into your introduction. Now, this is an example of how to write your introduction. I am writing to express my sincere interest in the radiographer band 6 position at this NHS trust. I am a qualified radiographer with 6 years post-qualification experience in both university teaching hospitals and private hospital settings. I am fully registered with HCPC and currently possess the required licenses to practice in my country, Nigeria. I have extensive experience in cannulation techniques and I possess a cannulation certificate to complement this. Now, in some person specifications, they make it clear that they need someone who is fluent in written and spoken English. So your introduction is a great time to reassure them from the onset that English is not your problem. So an example of how you can say this is, as a highly skilled radiographer with a robust background in diagnostic imaging, I am excited about the prospect of contributing to your dynamic team. I bring not only clinical and technical proficiency, but also a strong command of English language. My bachelor's degree was conducted entirely in English and has equipped me with the solid foundations in both theoretical and practical aspects of radiography. I am therefore able to articulate complex concepts in English and I can communicate fluently with patients and colleagues. Your introduction is also a great time to tell the employer really quickly that you have taken the time to read through the person specification and job description, and based on your analysis, you believe you are suitable for the role. Now, if you possess all the essential and desirable attributes, make it known right away. If not, state what you've got, and if you're working towards getting any, make it clear as well. An example of how to do this is, having read through the job description and person specification for this role, I am assured I have attained all the essential criteria required. In line with your desirable attributes, I have multiple certificated evidence to demonstrate my commitment to attending relevant study days and courses, and I am confident that my clinical experience, proficiency, and technical expertise align seamlessly with the person specification requirements. Now, on to the second section of your ready-made table of content, which is the knowledge and experience section. This will form the second section of your supporting information. Now, at this point, you want to demonstrate your clinical experience and technical skill set as a radiographer. Looking at this person specification, it says you should have experience in A&E, theatre, and out of work hours. It says you should also have experience working as a lone worker in or out of hours, and you should have CT or MRI experience. So this gives you something to work with. And this is an example of how you can communicate this in your SI. In my current role, I work in a busy radiology department and I actively contribute to the dynamic environment of the accident and emergency department. I have participated in various surgical procedures in the theatre and demonstrated my commitment to providing quality imaging service during and out of hours shifts. Now, for lone worker experience, you could say, having worked autonomously in both in hours and out of hours settings, I am well acquainted with the responsibilities of a lone worker. My experience includes handling emergency situations effectively, demonstrating my ability to maintain composure and deliver high quality care independently. Now, for comprehensive knowledge and general radiography, you could say, throughout my career, I have developed a strong foundation in all general aspects of plain film radiography, as well as in specialized contrast enhanced procedures such as HSG, IVU, barium studies. My expertise encompasses a wide range of diagnostic procedures, ensuring a well rounded skill set that aligns with the comprehensive knowledge required for this role. Now, for CT and MRI experience, you could say, I bring hands on experience in both CT and MRI, having successfully performed scans in these modalities for the past 3 years. This expertise will enable me to contribute effectively to your institution's diagnostic capabilities. Now, if you read through the job specification, you will see that there is an expectation for you to observe the radiation safety regulations in the UK. That's currently IRR 2017 and IRMA 2018. So, this would be a perfect time for you to demonstrate that you have knowledge of these radiation regulations. Again, this is why it's important for you to read through everything instead of just focusing on the person specification. So, an example of how you can say this in your supporting information would be, in my professional portfolio, I bring a robust understanding of the ionizing radiations regulations 2017 and the ionizing radiations medical exposure regulations 2018. These regulations form the cornerstone of my commitment to maintaining the highest standards of radiation safety and ensuring optimal patient care in my role as a radiographer. Some radiography jobs want you to demonstrate knowledge of PACS, so this is also a great opportunity to include this. This is an example of how you can say this. Furthermore, I possess valuable hands-on experience with picture archiving and communication systems. This familiarity with PACS technology has not only contributed to the efficiency of managing and retrieving medical imaging data, but has also enhanced my ability to collaborate seamlessly within the digital healthcare infrastructure. My practical experience with PACS reflects my adaptability to technological advancements in the field of radiography. Now, another point in your ready-made table of content is having a CPD portfolio. So an example of how you can reflect this in your supporting information is, I take pride in my dedication to continuous learning and professional growth. I have consistently engaged in relevant CPD activities since obtaining my qualification, some of which include my quality improvement webinars, teaching and mentorship programs, conference attendance, and clinical governance training. Now, this is a good time to highlight what skills you've also gained by engaging in these CPDs. So you could say, engaging in these CPDs contribute to my versatility as a radiographer. They have contributed to broadening my skill set and ensuring that my knowledge and skills are up to date with the latest advancement in radiography. Now, for teaching and training experience, you could say, in my current role, I actively participate in mentoring students and providing guidance to new team members. I have also given poster presentations in-house and in national conferences. These experiences reflect my commitment to knowledge sharing and contributing to the professional development of others in the field. Now, the knowledge and experience section is also a good place to include how you are committed to adhering the departmental protocols, you're committed to following the hospital safety policies, infection control measures, escalating radiation incidences, etc., etc. Now, the next section in your ready-made table of content is your skills, abilities, and attributes. So this will form the third section of your supporting information. Okay?
Before we get into this, if you're receiving any value from this video and you want to continue receiving tips like this on how to become a successful radiographer or sonographer or related healthcare worker in the UK, then please subscribe to my channel. It really, really motivates me to keep creating content like this. So please subscribe. Thank you and God bless you.
Now, the skills and attributes section is usually one of the best places to give real life examples of how you've demonstrated the desired attributes in your supporting information. I'll show you how to do this with a real life example. Now, it's always helpful to use the STAR technique when describing real life scenarios. Now, S is for situation, where you describe the event or the situation you were in. T is for task, where you describe the task you had to complete. A is for action, where you describe the actions you took to complete the task. And R is for result and reflection, where you close with the result of your effort and you reflect on what you learned from the event. Now, one of the requirements in this person specification is manual handling skills. So you can cover this by saying, I am proficient in manual handling techniques. I prioritize patient safety and comfort during positioning for various radiographic procedures, preventing injuries to both patient and myself. In one of my past experiences as a radiographer at this hospital, I encountered a very challenging situation that required swift and precise manual handling. We had a critically ill patient who needed an urgent CT scan, and due to the patient's condition, the standard transfer equipment could not be used. Recognizing the urgency of the situation, I coordinated with the nursing team to carefully lift and transfer the patient onto the CT scan table. Utilizing proper manual handling techniques, we ensured the patient's comfort and safety throughout the process. This required close communication and synchronization with the nursing team, showcasing effective teamwork and manual handling skills under pressure. The successful execution of this critical manual handling task not only facilitated the diagnostic process, but also emphasized my ability to adapt to unique situations, prioritize patient safety, and collaborate seamlessly with the healthcare team. Some of the other skills and attributes you could talk about are your ability to work under pressure and your ability to use your initiative in clinical practice. So, an example of how you can say this could be in high-stake environments such as accident and emergency and during out-of-hours shift, I have demonstrated the ability to remain calm and focused, ensuring accurate and timely diagnostic imaging even under pressure. I am proactive in identifying opportunities for process improvement and implementing initiatives to enhance workflow efficiency and overall departmental performance. Now, another skill you can talk of is your ability to empathize with your patient's needs. So, an example of how you could say this could be I have experience working with a diverse caseload of patients, including geriatric, pediatric, and terminally ill patients. My empathetic approach to patient care ensures a compassionate and understanding interaction, acknowledging and adapting to the unique needs and concerns of each patient. Now, the next section is about how you demonstrate the trust's values. This is another good section to include real life examples if you have any. In this trust, the values are heart, honesty, equity, accountability, respect, and teamwork. So, this is an example of how you could capture all of this in your supporting information. Now, throughout my career, I have consistently demonstrated a deep commitment to the core values of honesty, equity, accountability, respect, and teamwork within the framework of the trust. These are the ways that I embody these values. I prioritize transparent and open communication, ensuring that honesty underpins my interactions with both colleagues and patients. This commitment establishes trust and fosters a culture of integrity in my work environment. I also recognize the importance of fairness in healthcare delivery, and I actively advocate for equitable treatment of all patients, irrespective of background or circumstances. This commitment extends to ensuring that each individual receives the same standard of respect and care. Respect is at the forefront of my interactions with patients, colleagues, and all members of the healthcare team. I value diversity and uphold the dignity of every individual, fostering an inclusive and supportive environment. I have received feedback from my patients about being respectful and courteous in my interactions with them. I actively engage in collaborative efforts with my colleagues and personnel from other departments, recognizing the significance of teamwork in providing comprehensive patient care. This commitment involves effective communication, mutual support, and my willingness to contribute to shared goals. I take responsibility for my actions and decisions, acknowledging the impact they have on patient outcomes and the broader healthcare team. This commitment to accountability contributes to a culture of continuous improvement and learning within the workplace. Now, this is an example of how you may have demonstrated accountability in practice as a radiographer. Okay, so In my previous role, I encountered a situation where an unexpected technical issue resulted in a delay in processing a patient's imaging results. Recognizing the impact of timely reporting on patient care, I took immediate accountability for the situation. I promptly communicated the issue to both the patient and the referring physician, providing transparent information about the delay and the steps being taken to resolve the technical issue. Additionally, I liaised with the technical support team to expedite the resolution process. Now, taking ownership of the situation, I ensured that the patient and relevant stakeholders were kept informed throughout the process. Once the technical issue was resolved, I conducted a thorough review to understand the root cause and implemented preventive measures to minimize the likelihood of similar occurrences in the future. This experience highlighted my commitment to accountability in my radiography practice, ensuring transparency, effective communication, and proactive measures to address challenges and uphold the standard of patient care. Now, always remember to never include examples that paint you in a negative light, because human beings are reading your supporting information and they will naturally be biased against any captured negativity. So be mindful of this, please. Now, having captured all of the above, you can nicely move on to your conclusion. Okay. Now, in your conclusion, you could say, I am enthusiastic about the prospect of contributing my skills and experiences to your team. My experiences and qualifications collectively showcase my dedication to meeting and exceeding the expectations outlined in the person specification for this band 6 radiography job, and I am confident in my ability to deliver if considered for the role at this NHS trust. Thank you for your time. I look forward to the opportunity to discuss my application further. Now, some helpful tips for you. Remember to always tailor your supporting information to the specific job that you are applying for. Copying and pasting for all your jobs may be detrimental to your application. Now, I have a video on my channel where I talked about my personal journey and how copying and pasting doing this affected my chances of landing jobs. You can check it out. I'll drop the link below. Now, also remember to proofread your supporting information. This is very vital. Any supporting information that is riddled with too many grammatical or punctuation errors will naturally put off any employer. Now, I elaborate more on this in my video where I talk about the things you must not do in your supporting information. You should check it out on my page. I'll also drop the link below. Now, please remember not to copy and paste other people's supporting information. Plagiarism is a big deal and it really minimizes your chances of success. Just like what I've shared in this video today, use what I've given you as a guide to help you in crafting an outstanding supporting information that is authentic to you to maximize your chances of success. Now, remember to also stick to the word count. This is super important. Include any voluntary work that you may have undertaken in the past. Address any gaps in your employment if you have any. Also, I have very interesting and related content on my website, so please head on over. There's lots of useful information on there for you, and I'll drop the link below. Now, if you need any help with your supporting information, I do provide this service. You can drop me an email and we can talk about your options.
If you want to keep receiving very helpful tips on how to achieve your career dreams as a radiographer, a sonographer, or related healthcare professional in the UK, then please subscribe to my channel. You help me by subscribing, by liking, by commenting, and by sharing this channel. It motivates me to keep creating content like this. So hit the notification bell and I'll see you in my next video. Thanks and bye.